So you just heard about this problem where there are too many solutions out there and no real strategy to bring those solutions together. And I think that is a real challenge when it comes to partnering with the tech sector on global health. The partnership we're about to talk about, the work that the World Health Organization has done to engage with the tech sector, I think is a good model of how to tackle that problem. So I just want to set the context here. Just over a year ago, Andy Pattison from the World Health Organization, who you'll meet shortly, took a flight from Geneva to Seattle and San Francisco to meet with different tech companies and talk about the role they would need to play in tackling COVID-19. They met at Facebook's headquarters in Menlo Park, California, and they formed what they call a tech task force focused on responding to COVID-19. So you're hearing from some representatives of that tech task force right now, and thrilled to have all of you. Let me go ahead and jump into some quick introductions before we get into this conversation. I'm thrilled to be joined by Rakesh Barania, who's the Director of Humanitarian Impact Data at Salesforce.org. Rakesh focuses on the intersection of emerging technologies and international humanitarian crisis response. So it's no surprise his focus over the past year at Salesforce has been on COVID-19 response. Kylie Holmes is the manager for global crisis and disaster response programs at Facebook. She leads Facebook's COVID-19 response program, which you'll hear more about in a moment. Machi Jadema is strategy and business development lead at WhatsApp, where she leads COVID-19 vaccine response partnerships. This includes a partnership with the World Health Organization on WHO Health Alert, which again, you'll hear about. And Andy, who I mentioned earlier, Andy Pattison is the digital solutions manager at the World Health Organization. And partnerships play a key role in his work to amplify public health messages to more people through more channels. So I'd love to start with a question for Andy. You and I have spoken before about how the WHO prioritizes which partners it's going to work with. And one of your guiding principles is to meet people where they are rather than try to drag them into your channels. So I wonder if you can expand on that point and just share what other advice you have for global health organizations seeking to partner with tech companies.
Yes, thank you very much. Thanks for the invitation. Yeah, we could spend a lot of time and effort pulling people into our channels, and indeed we do. But what I've done is I've flipped this strategy completely on its head. And to sort of explain how we do that, I want everyone to just think back to when they used to travel to work. I know a lot of people are working from home, and how they would get to work. They would take the same car or the same bus or the same public transport along the same roads at the same time and park in the same car park and take the same elevator to the same office. These are habits and they're very hard to break, even if you want to break them. The same can be said for your digital journey. And so what we're trying to do is, rather than change people's habits, is meet them where they are. So your average mobile phone, your average smartphone will have 30 apps, but on a daily basis, people will use only 4 of them. My job is to get to the 4 that are on your phone, whatever they are. And the way we do that is we talk to our partners and give them the problem definition. We don't look at the solution definition. We don't say, oh, we'd like our content to appear on this application or this product. We say, okay, what we want to do is reach people with this content. And we leave them understand the solution definition and define the solution definition. And usually where the 2 problems overlap is a sweet spot, and we work in that sweet spot. And I would just encourage people to ask. If you don't ask, you don't get, right? So I would say have the conversations with the tech companies.
Great point. And I think one of the challenges in this moment, and maybe we can get to this in the conversation, is that day where you gathered with some of the speakers we're about to hear from in Menlo Park was so critical in forming the relationships that have continued over the past year. And now that everything's virtual, I think it's sometimes harder to form those relationships if you don't already have them. So maybe we can get into how that can be done. But next, I'd like to bring in Machi. And Machi, my question for you relates to the trade-offs that tech companies have to make. I mean, you have your day-to-day priorities, but you also have your partnerships with the WHO and other global health organizations. And I know for WhatsApp, you have to consider the trade-offs between helping groups like WHO reach communities at scale, while also preserving the experience that makes the WhatsApp platform popular. So you've said WhatsApp is in learning mode right now, and I'd love for you to expand on what are some of your key learnings so far.
Absolutely. And I think you nailed it in terms of framing the kinds of key strategic questions that we need to balance as we do more and more in this space, especially during such a challenging time. So we've learned a lot. I believe, we kicked off the partnership with Andy and team about close to exactly a year ago, specifically at WhatsApp. And there's been lots of learnings. And there are three that really stand out to me. So three highlights. One is keep it simple, and I'll kind of go into more details on each one. Two is constantly iterate and learn. So to the theme around the learning mode, I was also thinking about that from a digital solutioning perspective. And then the third is localize, localize, localize. And I'm sure everyone can understand why that's important within a global context for a global response. So I'm keeping it simple. I just wanted to kind of go back to what Andy mentioned, where he said a key pillar of their strategy and on the digital side is really partnering with some of these platforms that are already on people's phones so that you're not dragging them into a separate platform if they're already engaging on a daily basis on an app like WhatsApp. One of the things I think we've nailed and we did right with the WHO solution is just having something that's simple and delightful to use. So anyone who uses the solution would see that it's quite intuitive, and that's not by accident. We actually spend a lot of time with the WHO team as well as with channel partners that we work with to build a solution to kind of be thoughtful about the user experience, keep it delightful. Anything from being thoughtful about, for example, adding stickers, which is something that we added later on, to making sure that it has videos and rich media, and just kind of not complicating the experience. So it continues to be something that people can relate to and can share with their family and friends. As I mentioned, the second is around constantly iterating and learning. So a lot of times with this digital solutions, what we find is, people launch things, they're successful, and then that's it, it's successful, and then they move on. I think one of the things that we got right, and frankly, that we learned over time that we needed to continue to do was we just need to continue to iterate and improve on what we've built before. So with the pandemic, there have been several needs, right? Initially, it was just core information. Over time, we realized mental health was an issue. Over time, there are just kind of other issues that crop up. So making sure that you're delivering that impact. And then the last is really on localization, making sure that you're putting in the right languages, you're addressing like the right issues people are looking for, et cetera. So those are the three we've learned so far. And I'm looking forward to the learnings we get this year. But what just wanted to highlight those three as key pillars that we've been focusing on.
Thanks, Machi. And given the focus on partnerships all day today, I should mention that in a lot of these partnerships between the WHO and large tech companies, there are others involved as well. So for example, between WhatsApp and WHO, you have the PRAKELT Foundation and PRAKELT.org playing a key role. So I would encourage our audience to listen closely as there may be opportunities for you in the context in which you work to actually play a role, even if you aren't one of these large tech companies whose names we all know. I want to go to Kylie now. And Kylie, WhatsApp is, of course, owned by Facebook. It's one of the many ways that Facebook is partnering in COVID-19 response. But Facebook is doing a lot in COVID-19 response. And you specifically are leading Facebook's work to provide ad credits and marketing agency support to more than 130 ministries of health, as well as WHO, UNICEF, and other nonprofit partners globally. And I know that your background is in humanitarian response and that global health equity is very important to you as you prioritize which partnerships you pursue. So can you expand on that?
Definitely. And I think, and also just picking up on a point that you just made about the companies big and small, in the group that Andy is convening, it does now include over 20 companies, including some smaller tech companies. So it is true, there is opportunity for people to engage at all levels on all things. So I think equity has been at the core of our program from the start. And this has been something that's been really important to us, and also an area in which we had to apply a lot of creativity, because we were using, I guess what you could say is one of Facebook's kind of superpowers in a way is that we're using our advertising platform to spread messages on public health, but also helping partners do that. The ad platform, in the way that it works, is an ad auction. So it works slightly differently in all places. The prices are different. And also partners, although there's equal access, partners may not have the technical expertise needed to run ads. And we did find that with a lot of the public sector partners, for example, in the very beginning of the crisis. Many of our partners, including actually WHO, had less experience on running ads, especially on social media. And so we had to find a way quickly to level the playing field. And the way to do that for us was essentially to look for external marketing agencies. We call them Facebook marketing partners, but they're basically ad agencies that specialize in social media. And we brought some of them on board to provide kind of free support and hours to our partners in combination with free ads, which we were providing. And that we found was a great equalizer, right? So it didn't matter if you had experience running ads on the platform before, or if you had your own agency or a lot of budget. When we were able to pair the free ads with the technical support from this external agency, it allowed countries, for example, and ministries of health that may not even have a web page that is super updated, to run these really sophisticated ads on the platform and target specific messages in specific languages to very targeted groups on the platform. And we found that was a really good way to kind of level things globally and ensure that everyone had the ability to run the same type of campaigns with that core preventative health messaging. We're doing the same thing on vaccines now, obviously watching carefully the distribution of vaccines and helping partners act when it's right. But the same thing, we're providing these resources in the same way moving forward, because we did find that it allowed partners and countries big and small to do something that we felt like was very powerful.
I think a big challenge that will come up throughout the day is the challenge of misinformation. And of course, misinformation is spreading online and on social media, but social media companies are also working to tackle that misinformation. So it's really helpful to get some insights on that. And I think we'll return to the issue of trust later in this conversation and the role that tech companies can play in helping to tackle this problem of trust that has arisen as a real challenge over the past year. I want to go to Rakesh. So Rakesh, for those who are less familiar, Salesforce.org is working to enable the distribution of 2 billion vaccines via the COVID-19 Vaccines Global Access, or COVAX facility. And data is obviously central to this effort. So I'm curious, can you tell us a little bit more about how Salesforce.org is partnering with some of these large international health organizations, not just the WHO, but Gavi, CEPI, and other international health organizations on COVID-19 distribution? And I want to hear about the role of data, but also partnerships in the work that you're doing.
Yeah, so thanks very much. I think like every other tech organization represented here, we had to pivot and really start to really think and innovate around an emergent problem that wasn't on our radar a little more than a year ago. And I think initially our first thought was, how do we protect the frontline healthcare workers and such? And so we at Salesforce actually sourced 60 million units of PPE during the early days of the pandemic, when PPE was in short supply for healthcare systems and for nonprofits and for governments around the world. And then initially, that was something that we did early on, almost improvised. It wasn't a core competency. We weren't in the PPE business, but we really did realize that we needed to innovate in an ethical and protective way. When you are talking about data collection for people in various contexts, we want to make sure that we're approaching it with a certain, we want to move fast but do no harm. And so, for example, we came out with contact tracing applications for state, local, national government level contact tracing efforts, as well as for private businesses who needed to do contact tracing within a factory or facility or what have you. And then we ultimately moved from some of the initial, what I would say, adaptation, right? Digital transformation and resources to help organizations adapt to this new reality. I think then our focus shifted to more of a mitigation strategy, which is, how do we bring our technology and our capabilities to actually mitigate the human suffering caused by the pandemic and all the resultant disruptions to that. And so Vaccine Cloud is really our centerpiece for that. So Vaccine Cloud is a platform that allows organizations at every size, whether it's a small nonprofit all the way out to these large international coalitions like COVAX, to manage their vaccine distribution or vaccine campaign on the pandemic. And for us, we centered on 3 elements of impact. We call it the 3 E's of vaccine impact, which is efficient, effective, and equitable. Right, that's what the world basically demands from this next phase. And so, we were really pleased yesterday to hear that Ghana was the first country to get a COVAX distribution of 600,000 doses of, AstraZeneca, and we are really happy to support that. But going to the partnerships, these partnerships are going to be continuing to roll out as we move through here. And so, like, one that we're looking at right now is with the NetHope Coalition, which is an emerging convening to get vaccines and how do we use technology to enable the vaccination of the 235 million people who will need humanitarian assistance this year because of either conflict or disaster, right? The most vulnerable of the most vulnerable. How do we reach them and use technology to actually get vaccines to them? So this problem will continue to be with us for a while, but I think that these kind of partnerships and just engaging in the conversations is going to be so important for all of us, because none of us have the ability to solve it on our own.
Couldn't agree more. And it's why I'm so thrilled we're having this conversation. And earlier there was a question in the chat, which I encourage attendees to use, around data security. So Rakesh, in some ways you addressed that question directly when you talked about the way Salesforce is looking at this. Often you hear that move fast mentality among Silicon Valley tech companies, but move fast and do no harm. I think is really important framing. I want to bring in a question from a member of our audience and go ahead and encourage everyone on the chat to please post your questions. Earlier, you heard from Raj Kumar about the Bay Area Global Health Alliance, and I believe we have a question from their executive director on this important question of trust.
Thank you, Catherine. The Bay Area Global Health Alliance was launched here at Prescription for Progress, and it's really good to be back. We are now a vibrant Bay Area global health community of 50 members from all different sectors: academic institutions, NGOs, tech, biotech, and other private sector companies. We've also been really fortunate to be able to have the opportunity to work with Andy and the WHO Tech Task Force. I have a comment and then a question. Tackling misinformation and disinformation is really tough, and I applaud the amazing progress that you all have made. But we're living in a time that some people call the post-truth era. Trust in government, in institutions, in science and media is at an all-time low. And that really complicates how we address threats, whether it be for nuclear threats or climate change or vaccine hesitancy. So my question is this: how are you dealing with this global crisis of trust? What partnerships are needed to help renew trust? And lastly, how can the Bay Area Global Health Alliance help? Thank you. I really appreciate this opportunity.
Thanks, Sarah. All right, who wants to take on this big question around trust? Rakesh, this is the signal for me as a moderator these days. You unmute, it's your time to go. Go for it.
So I think it's a very, very interesting and very broad question. I think that we all have to recognize, and I agree with the premise of the question, which is that we are operating in a global crisis of trust. And trust is a function of execution over time. And so we have to show up consistently, we have to show up well, and we have to show up in fundamentally a transparent and accountable manner. Now, from our perspective at Salesforce, we realized that some of the data that we're talking about here may be considered extremely sensitive. When we talk about contact tracing and other things that directly relate to behaviors of individual human beings, that's very sensitive data. And so we wanted to make sure that we had we had a principled approach to how we engaged in developing these applications and how we're executing against them. And so we actually published our privacy guidelines for COVID-19. We wrote articles on how to rapidly innovate, but also do risk mitigation so that you actually had the speed of action, but also weren't accidentally creating a Big Brother type scenario. And we scrutinize all of our actions against a protective lens. The challenge is that in a crisis, right when you need to be most concerned about security and privacy, the crisis itself has a forcing mechanism that, unless you're really thinking it through, may cause you to ignore things just when they're needed the most, right? So just because we have to move fast doesn't mean we need to ignore security or ignore privacy or ignore civil liberties.
So well put. Thank you. Kylie, I know Facebook has done a lot of work on this issue of trust, and later today we'll be hearing from Heidi Larson, who leads the Vaccine Confidence Project. That's just one example of a partnership that Facebook has worked on as it works on this trust issue. But can you share, in response to Sarah's question, how you're thinking about this trust issue and how groups like perhaps the Bay Area Global Health Alliance might help?
Yes, definitely. I think this issue is obviously core to all of our work, and I think You can't build confidence in something if there's a lot of mistrust and misinformation circulating. And we certainly understand that as a company, and we're taking really strong actions on misinformation on the platform, using actually some tools that were already in our toolkit and generally used in cases where there were, there's misinformation that caused, physical violence in the offline world. A lot of those same policies actually apply to health information now, which is great. But as everyone here knows, a lot of the bad actors are quite prolific, and misinformation thrives in the absence of accurate information. And so this is why a huge part of our strategy has been on the work that I described earlier in pushing out that authoritative content from the sources that people know and trust the most. So not pushing it out in Facebook voice, although we've done that, also. We're really looking at amplifying those voices that are most trusted by the communities. And that means that we need different voices, and we need voices that look like the communities themselves. So in fact, Andy convened a group of us yesterday to discuss this very topic, just around how do we reach communities that might have higher levels of distrust. And I think that the themes that are emerging is that we have to diversify our strategy here and build trust by using organizations and individuals that are already trusted by some of the communities that may have very legitimate concerns or confusion around something like the vaccine. And so our focus this year is definitely diversifying. We're going to continue to partner with the ministries of health globally, with WHO, UNICEF, and some of the globally recognized public health organizations and institutions. But we're also working with people who are like group admins on Facebook, for example. Like, they already manage large communities of people. There's a lot of discussion. The moderators of those groups are generally trusted and known by the community. So we're working with those types of folks, or people who are just active in like a hyper local level and helping them put out content or amplifying their content on the platform. So we're trying to do both now, but really we want to ensure that there's a balance of the authoritative content while we're removing or downranking the bad content. So, and this is how the Bay Area Global Health Alliance is serving as a partner, as well as others, in that we're constantly reaching out to experts to help inform these strategies and take part in the response.
Thanks, Kylie. I think this important combination of not just technology, but tech and trust will likely be a theme throughout the day. I want to close in our last couple minutes here with a question. I'll start with Andy, and then if we have time, would love for others to jump in. Andy, I know that you hope this moment will be a turning point in terms of the way the global health community and the tech community partner. So can you describe, how do you see this as a turning point, and what should we be aiming for moving forward? I know you're working on the unmute, or my colleagues need to unmute.
Hi, I've lost sound, but maybe you can hear me. I caught most of that question. I think from my point of view, I think we really need to look forward as to what COVID has been a catalyst for change, and we've achieved a huge amount in the last 12 months together. What I would like to see is that we focus now on moving this. Once we finish this pandemic and we've all gone back to sort of normal lives, let's not lose everything we've done here. Let's use it as a springboard for future, for building, for growth, and use this to tackle other health issues, or other issues which is of concern to everybody. Imagine if we could deal with, for example, climate change in the same way as we're dealing with COVID. The whole world coming together, finding solutions, making it up as we go along for the good of everybody. On a personal level, looking forward, I just hope we have more respect for doctors and nurses, and in the future, and slightly less maybe for actors and football players. But that would be my personal wish.
Thanks, Andy. We're running low on time here. Machi, did you want to jump in really quickly?
Yes, for sure. And I'll keep it succinct. Just to echo Andy, I think, that's how we feel too on the WhatsApp side. The future we've been dreaming about, COVID helped kind of accelerate that. And so how can we use this as a point in time to drive transformational impact, not just in a COVID environment, but post-COVID? I think that's incredibly inspiring, and also take the learnings from that to really tackle some of the biggest problems facing the world, whether it's climate change, global poverty, figuring out how we can really leverage digital to accelerate change and drive human progress.
Thank you so much. Really appreciate all of your time. And I want to just end by, Rakesh mentioned efficient, effective, and equitable. And I think we've gotten some insights on how tech can play a role in each of those areas. So thank you. Now I'll hand it over to Rajesh Gupta of Vero Biotechnology, which, he'll be talking about this as a critical moment to advance new tools for infectious diseases. Following that, you'll hear from the U.S. Development Finance Corporation on ways to mobilize private sector investments in global health. Thank you all.